Okay, this is an update for faculty on the coronavirus and our safeguarding measures. Look at the date. The date is mid-July 2020. This virus is changing, and we're learning more about it. So, probably in a couple of months, we'll need to update this. But this is what we know now. And it's really important that you, as the faculty, you're all essential workers, that you have accurate information. And so over the last, really since March, we've been putting out information for faculty and students. And we've been putting out policy statements. Just last week, policies were issued for faculty, so you'll be signing some of those and reading some of those. And, please make sure that you read these not just once. I know when sometimes you get paperwork and we have people when they have to sign all this stuff when they get hired, you ask them the next day what they remember, and usually you get a blank stare. But for these COVID-19 policies, it's really important that you read them more than once, and really kind of internalize those policies. It's really important for you and for our students and for your coworkers. So right now, when our students are mostly confined to the campuses, the greatest risk to our students is you. The faculty who come to the campus on a daily basis, the campus or the site where they work, and have the possibility of bringing the infection into our environment, where it could cause students and other faculty members to get infected and get sick. So, people ask, and we also want to talk during this presentation about your off-campus behavior. And, people say, hey, when I'm not working, you can't control my behavior or tell me what to do. And that's absolutely true. We can't tell you what to do. But we can tell you, if we think if you've been involved in risky activities, we can tell you not to come to work. So you may have to, if you've been involved in something that's risky and been exposed, you may have to be quarantined, test a couple of times negative. And if it's really risky and irresponsible, you could lose your job. So let's not do that, okay? But I just want to say that up front. These recommendations we're going to be making in terms of your off-campus behavior are for your benefit and also for the safety of our campuses, our students, and your fellow faculty members. So what's happening in our country? Well, you guys are all watching the news, I'm sure. The virus is exploding in our country. We have the highest rate of infections in the world, and more infections and more deaths. And both in California and in Arizona, it's really spiking. And the sad part about it is it really didn't have to be this way. If you look at Europe, for example, or China, for example, the curve went way up and then it dropped back down, and they are now able in many places to really go back to pre-pandemic behaviors in terms of their work, in terms of socializing, and they can contain little hot spots. But we didn't do that. We didn't do the testing. We didn't really have a national strategy. And so we are off the hook. What does that mean? It means that there's a lot more virus out there. We're in a much, much more serious situation than we were in March when we did the original policies for Amity. It is really likely, if you go out in public, that you are going to be in fairly close proximity to somebody who's infected. That because there's so much infection out there. So that means that the safeguarding is really, really critical. So let's take a minute and review what we know about this virus. We know that it's highly contagious. It's the most contagious thing that any of us have ever really been exposed to in our lives. It can be passed by touching surfaces. If somebody is infected, and in many cases don't even know it, they can touch a surface. You can come along, touch that same surface, and then end up, rubbing your nose or, whatever, before you've had a chance to wash your hands, and boom, you've got the virus. But mainly, and this is really important, it's passed by these droplets emitted from a person's mouth. And while I'm talking to you, I'm emitting droplets. And so we know that's why the 6 feet physical distancing is really important, because these large droplets don't travel that far. But here's the thing we didn't know a few months ago, which is also there are these micro droplets. They're like an aerosol that is also being emitted from my mouth right now as I speak. These micro droplets, of course, are you don't feel them, you don't see them, but they can be in the air in a room for up to 3 hours, particularly a room that doesn't have good ventilation. Later on, we'll talk about, but you'll get it, why being outside is much, much safer than being inside. So think about you have an aerosol, maybe a bathroom spray to make your bathroom smell better or something like that. You spray it in the air, and you see the little thing shooting out, and then it disappears. But the whole point of a deodorant is the smell stays there for quite a while. Well, what is the smell? It's those micro droplets. So think about this. You could walk into a room, it's totally empty, but some people have been in there in the last hour or two, and the room is filled with these micro droplets, and you are at risk of infection. That gets back to the why to wear a mask, and why being outdoors is a lot safer than being indoors. So the riskiest situation for transmission of the virus is a case where people have close interactions in an enclosed space that's not very well ventilated. Practically speaking, that means closer than 6 feet in a room, poor ventilation for more than 5 minutes. Now, isn't that really interesting? They expected a huge spike in the virus when all those protests were taking place. Some of them are still taking place. But they didn't really get a big spike. It doesn't mean that no one got infected. Well, why? Well, they were outdoors. Most of the people, not all of them, but most of the people were wearing a mask. And they were moving, okay? So you didn't have the close association of people kind of clumped together and talking to each other. So even though it was still risky, you really see the advantages: ventilation, outside, not having close contact, and moving. Were all things that protected people, even in a mass kind of situation. Remember that most of the people who are infected are asymptomatic. They don't have any symptoms of the disease, but they can be highly infectious. And they don't know it, and you don't know it. And so one person can become a super spreader in a crowd situation. That person infects somebody, that person goes on to infect somebody else, and wow, the thing just goes like wildfire. And that's why the United States is doing worse than any other country, because we really have not taken the steps to, first, we didn't do the stay-at-home order very well. Then secondly, we opened up stores and hair salons and gyms and entertainment venues much too quickly before we'd really knocked the virus down. And so you had all these infections going around. People, the beach parties in Florida, this kids on the beach acting normally like college students do on a spring break, and of course infecting each other and then going back to their homes and infecting their parents and back to their schools and so forth and so on. So what are the simple prophylactic measures? Again, we've talked about this before, but a friend of mine used to say repetition is conviction. So this is repetition. Hand washing frequently is absolutely essential, and particularly if you think you may have been exposed to something. You grab a doorknob and then you think, how many other people have grabbed that doorknob? Immediately go and wash your hands, you know. So hand washing, wearing a new or disinfected cloth or surgical mask. I can't overemphasize this. You know, it's this crazy in this country that this has become kind of an image issue or a political issue. It's neither. It's really just a health prevention measure, and a very, very effective one. One of the things I read today, which we didn't know, we talked about surgical masks being worn primarily, you're protecting somebody else. So I wear a mask to protect you, you wear a mask to protect me. But we were saying, well, those surgical masks really don't provide very much protection for me when I'm wearing it. Wrong. They're now discovering that even a paper mask or a cloth mask or even a bandana really makes a fairly significant difference in terms of protecting you. So even more reasons to wear your mask. And make sure, we've made a video on this, you can find it on our YouTube channel, Amity Foundation USA, how to wear a mask. And there's a lot of information on how to wear a mask, what the different masks do. But clearly you must disinfect your mask. If it's a cloth mask, you need to wash it every day. If it's a surgical mask, you got to put it in a paper bag for 24 hours, sealed paper bag, before you wear it again. Physical distancing, and I don't use social distancing, I call physical distancing, because we really want to be socially interactive. But we want to do it from a physical distance, so we're safe. So physical distancing of 6 feet more when you're outside of your home bubble, and we're going to talk about the bubble in a minute. Using a strong disinfectant to clean surfaces, and you can easily look up which ones are effective. But you want to use something that will actually kill virus, and you want to let it dry when you use it. Wearing gloves when it's necessary. You go into a situation where you can't hand wash easily, wear gloves, and then take the gloves off when you're out of that situation. Wearing enhanced PPE, personal protective equipment, when you're in a situation where you know there is infection present. And that means an N95 mask, that may mean a protective gown or other protective equipment. Because if you're in a situation where you know there's a virus and a lot of virus, you need to really make sure that you don't get infected. Remember, this stuff is highly contagious. If you don't like wearing a mask, you're really going to hate being on a ventilator. Okay, okay. What's the golden rule? Well, we all kind of know it, probably from primary school. Do unto others as you would have others do unto you. Real simple. You want to treat people like you want to be treated. And never has this been more relevant than right now. You wear a mask to protect the other person, and you hope that the other person is practicing the golden rule as well and wearing it to protect you. So we have to really practice the golden rule now. That has to be our North Star, our guiding principle. Doing everything we can as we would hope others would do for us to protect us. If we all do that, guess what? We will be safe. Our students will be safe. Our coworkers will be safe. And ultimately, if everybody kind of get on board with this very simple principle, we can get rid of this virus. Okay, let's talk about the bubble. The bubble concept here, we're going to talk about two bubbles that are very important. One, the bubble you live in, either alone or with a partner or with children or all of the above. Second bubble is the bubble you work in at Amity. So let's talk about the home bubble. Think about this as a bubble. It's a little protective membrane around where you live. This is your safety area. This is the area where you can live somewhat normally, okay, if you take prophylactic measures. You don't have to wear a mask. You don't really have to worry about contamination. You can have physical interaction with the people inside your bubble. You can hug them and touch them and whatever. How do you protect this bubble? Because it's really important. Well, anyone coming into your bubble, you, your kids, etc., entering your bubble from a potentially risky area, and remember, kind of everything out there is risky, should shed your clothes at the entrance, immediately shower, don't touch things on the way to the shower, soiled clothes, go to the laundry, you handle them with gloves or you handle them with your hands and immediately hand wash, and you launder those clothes before you wear them again. Now, this may sound pretty extreme, but it's not. It's a good way. It's a great habit, and a lot of this is we have to develop new habits now in this new situation. Maybe 10 times you come in, you don't take this precaution. On the 11th time, you bring the virus into your bubble. Is it worth it? I don't think so. You're going to have to buy more laundry soap. It's a reality. At our house, that laundry machine is kind of going every day. But it's really important. Take temperatures, check for symptoms, and really protect your bubble. Because remember, this is your safe zone. Coming and going. So trips out of your home bubble, you should be doing them kind of carefully and thoughtfully. Don't just run off, when you have a feeling. Try and consolidate your trips. If you've got to leave the bubble to go and get groceries, pick up, that's a good time to get your mail if you don't have the mail delivered. It's a good time to go to the gas station, fill your car up with gas or whatever, okay? Try and consolidate your trips. So you take one trip and maybe do several things rather than several trips over several days. And really be thoughtful about that, because the more trips you take, the more opportunities for you to be exposed to the virus. So medical appointments, well, they come up, but one of the great things we have right now with our United Healthcare plan, we have what they call virtual visits. So you can call up and talk to a doctor, okay? And if you can, do that rather than going to a doctor's office. Because what happens in doctor's office? Lots of sick people go there, and they sit in waiting rooms with people they don't know. That office is probably not very well ventilated, so here you have a little petri dish for the virus and all those little micro droplets circulating around. So go to the doctor if you have to, for sure, particularly if you're symptomatic and you're worried about that. But don't just go. If you can do it on the phone, call somebody up, even to check on your symptoms, do it. That's your first step. You can get a lot of things these days delivered to your home. There's a lot of different delivery services. We all know Amazon, but there's many other delivery services. You can get food delivered, you can get products delivered, and if you can, that's a great way. Then you don't have to take a trip out of the house. But make sure when the stuff arrives, disinfect it. Okay? You can disinfect it with a solution of bleach. You can disinfect it with a disinfectant wipe, but don't just go and grab it and believe that it's safe, because it may have some of the virus on it, and you don't want to take that chance. Again, we can't tell you what to do. This is all recommendations that will keep you safe, and if we keep you safe, we'll keep Amity, the campuses, safe. So here's the recommendations. Don't leave home without your mask, disinfectant, and gloves. My car, I get in my car, I have my disinfectant wipes, I have my gloves, and I bring my mask from the house, of course. I don't leave it in the car. Don't be in a large gathering. There's rules in California right now as we're making this video, but even if the rules are not there, stay away from a gathering of more than 10 people. And if you are in a gathering of more than a couple of people, make sure you practice the social distancing. Make sure people are wearing a mask. Don't go to a restaurant, a gym, a hair salon, or other public places, even if the rules in your state, like Arizona, do not forbid you from doing it, because you are likely to get infected, and if you get infected, you are likely to bring it onto one of our campuses or sites or to one of your coworkers. Don't allow people in your home unless you know that they are practicing these prophylactic procedures, and hopefully they've taken a test very recently and they're negative. This is a great time to meet. You want to meet with somebody, do it outside, okay? Do it outside where there's ventilation and sunlight, and wear your mask, physical distance. Much, much safer. We're going to have to learn to protect that bubble that you're in. And of course, somebody comes to your house to repair your washing machine. You've been using it so frequently it breaks down, or your refrigerator goes south, or air conditioning has problems. Well, you're not going to be able to get the repairman to strip their clothes off and go to the shower before they do the repairs, I'm sure. So in those cases, you make sure they're wearing a mask. If they don't have gloves, you offer them gloves. And you make sure that they stay doing exactly what they're doing and not just roam around and touch a lot of things, and then make sure you disinfect after they leave. But anybody in your house, repair person or not, they must be wearing a mask, absolutely, or they don't come in the door. So here's some do's. We're talking a lot about don'ts. Okay, so don't. It's like being a first grader and having a teacher, point their bony finger at you. What are some do's? Practice physical distancing, but use every opportunity for social interaction and intimacy in these relationships that are so important to you. We're social beings, and this is a very, very difficult time for us when we really can't. It's so strange. I see a close friend, somebody I've known for years. I would hug that person. I can't do it. It feels so odd and so wrong, really. But being isolated is not good for us. So, you're living in this bubble, but you don't want to be isolated. So use your phone. You've got one. Use social media. It's fun to do that. Use Zoom or any of the other services like that for video conferencing. They're cheap. They're easily available. In many cases, they're free. And interact with your friends, with your coworkers, and your family members frequently. Stay connected. Okay, it's very, very important. And we're living in this sort of schizophrenic life where it's protect the bubble, but the other side of it is interact, make contact, talk with your friends and your family members. Nye and I do a Zoom call every Sunday with all the my kids and grandkids, and it's wonderful. We're actually having more contact than we did beforehand, and we really look forward to it. I mean, it's really, really great. Okay, outdoors is great. It's the best. You can go hiking, you can ride your bicycle, you can go to the beach if that beach is not crowded, and of course if it's open. Right now I think all the beaches in California are closed, but when they're open again, if you can go and stay socially distanced, hopefully on a day where there's a good breeze blowing, and keep your physical distance from people, that's fine. We can't, we're not designed to live in a cave. We have to interact, and being outdoors is good for us under any circumstances. Right now, it's the safest situation for us, is to do a lot of our social interaction outdoors while physical distancing. I'm going to talk about this because I think it's important, because people ask me, can I expand my bubble so that I can have some other people in my bubble that don't live with me but are really, really close friends? Yes, the answer is yes, but you got to be very, very careful with that. My daughter and her husband are working from home. They have kind of expanded their bubble to a couple of neighbors, all of whom have tested negative, all of whom are also working from home, all of whom they are very, very confident are practicing all these social prophylactic safeguarding procedures. And so they have two families that they interact with, and when they come together, they don't wear masks or do all that kind of stuff. They act as if they're all in the same bubble together. But the downside of that is you better be pretty confident that those folks are testing negative and that they are really practicing these, or disaster can ensue. The other part of this thing is if you have kids, hey, the complication factor just went up about tenfold. Kids don't really understand, particularly younger kids. Younger kids don't really understand this, and older kids think they're bulletproof. And all children are, of course, highly interactive. They want to interact with others. They want to rough and tumble. They want to touch each other and be close and so forth and so on. They're not really highly motivated to wear masks, although I'm really pleased as I do go to stores when I have to. I really see those moms with those kids, and they're all wearing masks, which is really great. But be careful right now. The school situation is up in the air. I hope that our school districts are going to be really, really responsible and not put our kids at risk. But remember, a situation came to my attention just last week. Two very healthy young adults. Their child came back, infected both of them. They're in the hospital. So it's risky, and you have to be careful. You're going to have to teach your kids when there are situations where they're interacting with other children. Just be careful. Another do is, this is a great time to have a really strong immune system. Immune systems fight viruses. So eat a healthy, mostly plant-based diet. You know, Amity, we've been promoting this for the last almost decade now, and it's really, really important. If you strengthen your immune system, even if you do get exposed to this virus, you are likely to have less symptoms, or maybe no symptoms at all, or if you do get sick, to be less sick. And of course, as we've said before, but it's worth repeating, stay home if you don't feel well, or if you have any of the symptoms of the coronavirus, and there's a myriad of those symptoms, and you can go to the CDC website and just look symptom guidelines for COVID-19, and you'll see them. Stay at home if any member of your bubble is sick or is exhibiting symptoms or just doesn't feel well and might have the virus. And if that's the case, then you need to stay home, and you'll need to kind of quarantine and get a couple of negative tests before you come back to work. The other thing about this, prepare yourself for the long haul. We've got months and maybe longer than months of living this way, in this very unnatural way, protecting ourselves and protecting others. And it can be, I read a story last week, some woman, absolutely pristine in terms of these. One day she just said, to hell with it, threw caution to the winds, and guess what? She's in the hospital. Because it only takes a minute, one incident, and to get the virus. Okay? So in terms of the work bubble, read those policies and get familiar with them and practice them. Make sure that other faculty and students follow them. Don't worry about hurting somebody's feelings if you see them doing things that are risky and unsafe. I'd rather have my feelings hurt than be on a ventilator, and so we gotta take care of each other, and sometimes the taking care of each other means being a little bit stern or harsh in terms of, no, put your damn mask on and don't let me see you again without it. Wear freshly laundered clothes to work. Hand wash frequently, of course. Wear your mask all the time, unless, of course, you're having lunch, and then make sure that you're physically distancing and doing it safely. The other part, we are a teaching and therapeutic community. So somebody asked me last week, well, what do I do because students don't want to wear a mask? Well, the answer is use all the tools of the teaching and therapeutic community and teach, teach, teach. Teach at morning gatherings. Teach at evening gatherings. Teach at seminars. Teach in circles. Teach in ceremonies. We have a teaching environment and we have multiple ways of teaching. Get the students involved in teaching each other. Okay? We're not going to throw somebody out because you have a student who's having difficulties understanding why they have to wear a mask. Hopefully, if we're keeping that bubble secure, they're not infecting each other, particularly because they're not going out of the campus right now. But that's going to come, and that's going to put a more of a burden on us. But right now is an opportunity for us to teach our students. Remember, the students have to physical distance, but they desperately need social interaction. So we got to have a lot of activities going on for them that are safe but meaningful. So be creative so that circles, seminars, workshops, gatherings, ceremonies are produced and provided 7 days a week. We don't want people both confined and bored. Remember that smaller groups really provide more intimacy. So in a lot of ways, this is an opportunity. And understand that this is a high-stress time for everyone. For you, for your coworkers, for the students. And it's easy to get on edge and be angry, short, discourteous, and we don't want that. That just makes it worse for everybody. So be considerate, be patient, listen to other people, and teach. So get the students involved. We could start a COVID core group on every campus. Because there's always a group of students who want to, teach, and they want to lead, and they want to do things. Get them together and get them learning about all this stuff and giving them assignments to teach it and to bring it to their peers. We should have, at least on every campus, one faculty member who, again, is very enthusiastic and knowledgeable about this, who can be the COVID-19 liaison, both to the management, the other faculty, and to the students, whose job it is to just keep updating us, making sure we're following our policies. Some things to remember. Remember, if you act like you are infected and contagious, and that everyone you meet is infected and contagious outside of your home bubble, then all these crazy things we're doing, all these extra steps we're taking, start making a lot of sense. And it's a lot easier to follow. If, on the other hand, if you start getting the attitude, because of you're watching television, you've got politicians saying, well, everything's school, it's all a hoax, or all these things that are completely wrong-headed because they have another agenda, which is not your health. So it's easy to kind of say, oh, okay, great, then I'm just going to go and do what I feel like doing today. Just don't believe it. Don't believe it. Stick with this. The key to this, look at a country like Greece. They've had 3,000 cases in an entire country. Why? They were very disciplined about this. And as a result of that, and there's some other countries also that have really, really been disciplined, but every time they loosen up, guess what happens? They have a spike. Okay? So we have to understand this is for the long run, and we have to maintain this discipline. And we have to have a good time and a good life while we're doing it, and not just suffer and be angry and upset. We've got to figure out how to live our lives in a meaningful way with good social connections with our students, with our coworkers, with our friends, with our family, and maintain the discipline and get through this. We're fortunate at Amity to have enough personal protective equipment. A lot of places don't, including frontline healthcare workers, and regular access to testing, which again is a bonanza for us. You are an essential healthcare worker, and what we do is an essential healthcare job. Take advantage of that we do have the PPE, that we do have access to testing, and get tested. Don't get tested once and think like it's all over. Remember, you can get tested at 1 p.m. in the afternoon on Monday, and 10 minutes later, and be at that test will come back negative. But 10 minutes after the test, you are exposed to the virus, you don't have a mask on, you touch a surface, and then touch your face, and guess what? You're not negative anymore. You're now positive. But you're acting as if you're negative. This is sneaky, okay? This is a trickster. The Native American mythology, this would be the coyote, this virus. It's very sneaky, very cunning, and we got to be sneakier and more cunning in terms of not getting infected and infecting others. So a negative test is a moment in time. It's nothing permanent. We don't even know whether the antibodies that people who have been infected or asymptomatic are a guarantee that they will not be reinfected. Looks pretty iffy in terms of that. So you've got to continue to safeguard yourself at home and at work. So that's kind of it for this update. Please read the policies. If you haven't seen the mask video, take a look at that because there's some very specific information on that. And please reach out to your coworkers and to our students and help them make this transition. Protect your home bubble because it's really, really important for your safety and the safety of whoever's living with you in that, and for what you bring to the campus. Thank you.